There was a time when medicine did not just fail to save lives. Sometimes it quietly made things worse. In hospitals, in offices, and sometimes in ordinary rooms with no surgical equipment at all, doctors performed treatments they truly believed were helping their patients. Families trusted them, patients trusted them, society trusted them, and yet many of these treatments would later be remembered as some of the darkest chapters in medical history. Tonight we step into a world where healing and horror existed side by side, where science, fear, and desperation collided, where some treatments that once represented hope would later become warnings. These are real medical practices. They were legal, they were common, and they changed thousands of lives forever. The ice pick. In the mid-1900s, mental illness was widely misunderstood. Depression, anxiety, schizophrenia, and trauma were often seen as unsolvable problems. Psychiatric hospitals were overcrowded. Families were desperate. Doctors were searching for answers. Then came the lobotomy. Doctors believed mental illness was caused by faulty connections in the brain. If those connections could be severed, symptoms might disappear. One doctor, Walter Freeman, became the public face of this procedure in the United States. He developed what he called the transorbital lobotomy. It required no operating room, no surgical team, sometimes barely any anesthesia. Instead, he used a tool that looked very similar to an ice pick. The instrument was inserted through the eye socket. A hammer was used to push it into the thin bone behind the eye. The tool was then moved side to side, severing connections in the frontal lobe. Freeman performed thousands of these procedures. Some patients became quieter, more compliant, less emotional. In that era, this was often seen as success, but many others lost their personalities, their memories, their independence. Some never spoke again. Some died from complications, and one of the most famous patients would come from one of the most powerful families in American history. Rosemary Kennedy, sister of future President John F. Kennedy, struggled with mood swings and developmental challenges throughout her early life. In the 1940s, mental health treatment options were extremely limited, and her family feared her condition could worsen. In 1941, at 23 years old, Rosemary underwent a lobotomy. During the surgery, doctors asked her to count and speak while they operated. When her responses slowed and became confused, they stopped, believing they had removed enough brain tissue. The procedure did not calm her symptoms the way doctors hoped. Instead, it left her with severe cognitive impairment. She lost much of her ability to speak clearly. She lost independence. She required lifelong institutional care. For decades, her condition was kept largely out of the public eye. Her case is now considered one of the most tragic examples of how experimental psychiatric procedures could permanently change a person's life. And at the time, her family believed they were making the best medical decision available. When blood was the enemy. For more than 2,000 years, one belief dominated medicine across multiple civilizations. Illness was caused by imbalance, specifically imbalance of the four humors: blood, phlegm, black bile, and yellow bile. If someone had a fever, infection, or even mental illness, doctors often believed there was too much blood in the body. The solution was bloodletting. Doctors used knives, lancets, or leeches to remove blood from patients, sometimes small amounts, sometimes massive amounts. One of the most famous possible victims was George Washington. During his final illness in 1799, doctors removed large amounts of blood over a short period of time. Many historians believe this contributed to his death. At the time, this was not seen as reckless. It was considered advanced medical care. Patients became weak, dizzy, and dehydrated, but doctors interpreted this as the body purging illness, Bloodletting persisted for centuries because sometimes patients survived anyway. When they died, the disease was blamed, not the treatment. It would take modern biology and germ theory for medicine to fully abandon the practice. But for generations, people walked into treatment rooms already sick and walked out with less blood, less strength, and sometimes no chance of recovery. Electricity. As therapy today, electroconvulsive therapy, known as ECT, is carefully controlled and used in very specific medical situations. It can help patients with severe depression and certain psychiatric conditions, but early electroshock therapy looked very different. When first introduced in the 1930s and 1940s, procedures often happened without sedation or muscle relaxants. Patients were fully conscious. Electrical currents were sent through the brain to trigger seizures. Doctors believed seizures could reset abnormal brain activity. Some patients experienced broken bones from violent muscle contractions. Memory loss was common. Fear was almost guaranteed. Historical patient interviews describe the terror surrounding early treatments. Some remembered being restrained and watching staff prepare machines. Some described the moment before electricity was applied as feeling like they were about to die. Doctors were aware of risks, but continued refining the procedure because some patients with severe depression did show improvement. Over time, safety standards improved dramatically, but early electroshock remains one of the most haunting examples of how treatment and trauma could exist in the same medical moment. The era of radioactive health products. In the early 1900s, radiation was not feared. It was celebrated. It represented progress, science, the future. Companies began selling radioactive health products, radium-infused water, radioactive creams, even radium toothpaste. One product, called Radithor, was marketed as a health tonic. It was literally water infused with radioactive radium. A wealthy industrialist named Eben Byers became one of its most famous users. He reportedly drank multiple bottles per day for years. At first, he believed it gave him energy and improved his health. But radiation poisoning works slowly. Over time, his bones weakened, his jaw deteriorated, holes formed in his skull. Doctors eventually realized the damage was irreversible. By the time of his death in 1932, large portions of his bone structure had been destroyed by radiation exposure. His death became a turning point in public understanding of radioactive consumer products, but he was not the only victim of radium exposure. In the early 1900s, factories hired young women to paint watch dials using radium paint that glowed in the dark. They were told it was safe. To keep brushes sharp, many were instructed to shape them using their lips. Over time, workers developed severe health problems. Teeth fell out, jawbones weakened. Some developed cancers and bone fractures that would not heal. They later became known as the Radium Girls. Many companies initially denied responsibility. Some tried to blame the women themselves. Eventually, lawsuits helped establish modern workplace safety laws and corporate accountability for toxic exposure. But most of the women suffered severe medical consequences long before justice arrived. Induced comas, as treatment insulin coma therapy was introduced in the 1930s to treat severe psychiatric disorders, especially schizophrenia. Patients were injected with large doses of insulin. Blood sugar dropped dramatically. The patient would lose consciousness and enter a coma. Doctors believed repeated comas could reset brain function. Some patients were revived successfully. Others suffered permanent brain damage. Some never woke up. Hospital records from the era show death was a known risk. Despite this, many institutions continued using the treatment because doctors believed the potential benefits outweighed the dangers. At the time, psychiatric medicine had few options. Families often approved treatments hoping for any chance of improvement. But for many patients, the therapy itself became the final chapter of their medical story. The twist. When horrifying treatments sometimes work, not every disturbing-sounding treatment was useless. Maggot therapy is one example. Sterile medical maggots are sometimes used to clean infected wounds. They consume dead tissue while leaving healthy tissue intact. They can even help fight infection. It sounds horrifying, but in certain cases, it saves lives. And that may be the most unsettling realization of all. Because history shows something uncomfortable, medicine is not permanent. What we believe is safe today may be questioned tomorrow, and what sounds terrifying might sometimes help. The history of medicine is not just a story of progress. It is a story of trial, error, desperation, and sometimes tragedy. These doctors were not monsters. Most were working with the best knowledge available at the time, but knowledge evolves, and history reminds us of something important. Good intentions do not guarantee good outcomes. Somewhere in the future, people may look back at our era and wonder how we ever believed certain treatments were safe, because the line between cure and catastrophe has never been as clear as we want it to be. And that is what makes medical history both fascinating and deeply unsettling.